Hi there, I'm Dr. Peter Carr, and you're watching this video because more than likely I've diagnosed you with a lumbar or cervical disc injury. Now, in the years past, I've spent a lot of time with my patients discussing with them what the cause is of the disc and how it works, what our treatment protocol for it is, and how to go forward. And it's taken a lot of time to do that. Now, here in the future, I'm going to try and load this video and have you watch it. I hope that you don't feel like it's depersonalizing in any manner, but I do want to discuss with you what's going on with you and tell you what exactly it is you need to do to get it taken care of. So, starting off, I'd have to say the first thing about the lumbar disc is that it is typically a very structural injury. That means that the damage that you're feeling is caused by mechanical processes, namely that the disc is pushing on the delicate nerve tissue. And wherever that nerve goes, wherever that level, spinal nerve level goes to, is typically where you feel the results, the symptoms that you probably came to see me for. So let's, without any further ado, let's go ahead and get started, and we'll talk about the mechanics of the lumbar disc, how it works, and this is Bianca, by the way. She may make an appearance here and there. How it works, and then what do we do about it once we figure that out. Okay, so let's go ahead and start talking about the disc. Now, the disc is a ligament, just like any other ligament. It holds bones together, and those bones, there's 24 of them in our spine called vertebra. Each one of them has a half moon on the top and a half moon on the bottom, and it forms a hole that the nerve comes out of. The disc itself is buried deep within each one of those vertebrae to hold them together. It also holds them apart. I'm sitting straight up and down. The thing that's keeping my bones apart is that disc. It has two parts to it. The tough annular ligaments that go on the outside of that disc, very similar to bandages, wrapped around a goopy center called the nucleus pulposus. Now, I've drawn that out for you in these beautiful pictures that I spent a lot of time working on here. This is a picture of the lumbar disc. This is the annular fibers here, and they're different orientations. And you can see how the nucleus pulposus is hidden inside that disc. It's great for dissipating force, dissipating shock, but the action of bending forward, the motion of slumping forward, is called flexion, and the disc does not tolerate that very well, especially when it's combined with rotation. So the majority of my patients that come back and tell me they had problems say it was because they were bent forward and rotated typically. It also usually happens more in the morning when there's more water in the disc. So I often find people get damaged in the discs more early in the morning. So this is a simplified picture of the vertebra in our spine. So this would be the bone from the side. This would be the spinous process, the bump that you feel on your back. Right in behind there is where the nerve lives, and then the disc lives right in front of that. There's also a ligament that runs on the front side of our vertebra. It's called the anterior longitudinal ligament. It's very thick and doesn't have any nerve endings. We'd love to have our discs herniate that way. Because we don't have any nerve endings up there, great, herniate all day long. The damage to the disc is something that doesn't typically happen overnight. Of course, it can happen in a major accident like a car accident or with a major fall, but typically the disc gets damaged through our lifetimes. And so the average patient age that I see is anywhere between 27 and 65. Now, that's not to say you couldn't have something earlier than that. I have had cases younger than that, but typically we don't see patients earlier than that, and we don't see patients older than that because the disc it's dried up. It becomes what we call desiccated, and so that desiccation doesn't allow it. It's kind of like squeezing a grape versus squeezing a raisin. If you're watching this video, you probably have a damaged grape for a disc. So again, damage to the disc, additive, cumulative. That happens because there isn't a good circulation source, blood circulation for the disc. So there's no rapid healing for the disc. There's no way for it to, well, to ever really heal. But it can be remodeled, and that's the thing that chiropractors and all other therapists try to drive at, is rehabilitating the disc and getting it to go to the places where we want it to be, namely away from where the nerves are. Some good activities, well, we'll get to that later. Let's go ahead and talk about the damage to the disc first. So the disc being damaged is not the problem that you're experiencing. And I say that because the symptoms you're feeling are brought to you by the nervous system. And so nerves have two functions. They have a motor function that goes away from the brain, and they have a sensory function that goes to the brain. Things that we feel are sensory, and that means that we've compressed about 50% of that nerve. Things that we feel when that happens are a deep aching soreness, a numbness and tingling, a sharp shooting pain, electrical in its nature, maybe even what we call a paresthesia, where you feel ants crawling on you, or a fluid sensation. Those are all consistent with the sensory side of the nerve, We typically feel it in a certain area wherever that nerve goes. That's called a dermatome. Derma meaning skin, tome meaning section. So if we have it in these three fingers, that is the C6 nerve distribution. C7, C8, T1. If we feel it in the back of our legs, 30 to 40 times more commonly herniated is the L5 lumbar disc. And so that has a very consistent pain message that runs down your butt cheek, down the back of your leg, even to the bottom of your foot. L3 runs across the top of the knee. L4 runs in between those two. So when we get worried, we being chiropractors get worried, is when you start to exhibit symptoms that cross over from the sensory side to the motor side. When the motor side is affected, that's a problem. It means that you can't lift your foot, or you have problems holding on to things. You're not able to function in daily society. That's when we're required to send you out for an orthopedic neurosurgical consultation and an MRI at the same time. MRI is really the best way to visualize the disc and the damage of the disc. The diagnosis is quite easy in my mind, but the actual size of your herniation can be different depending on what you feel compared to what you have. So we always like to have those pictures. We don't send patients out for orthopedic neurosurgical consultations just for fun. It's a serious diagnosis, and it's a serious appointment. We don't want to have anyone go in for surgery. It's one of the few procedures that has a code for failed low back surgery. Only 70% of the cases that go in for surgery are successful, and that bar is pretty low. It means that you're as good or better than when you went in. So we do everything that we can to try and keep you away from surgery. How do you manage this? What do you do at home? Well, the answer is that if flexion caused the problem, extension is the answer. So if we imagine that my hands are those vertebrae and they squeeze forward like this, that will shove the disc material, which is, you can kind of think of it like a jelly donut or a water bed or a grape. If you squeeze the front, it will go out to the back. Anytime we can pull those two pieces apart or open them up in the front, that will drive the disc material forward to where there aren't any nerve endings, and you may have the problem, but you might not have the symptoms ever. And that's really what a chiropractor seeks to find with you, is a point to which you are asymptomatic for the rest of your life. One of the best ways for you to manage that at home is exercise called cat and cow exercise. And you can see that I drew it out here pretty nicely for you. Bowing your belly out to the floor while you're on all fours really makes you mimic every other mammal in the world. That's a good thing. And if you have a kid that can ride you, have them hop on there. Well, go ahead and do it. Most of the patients who have disc injuries have kids. There may be some correlation there. But if it really does hurt, you want to lay on your back. with your legs up and elevated on something like a couch or a sofa or a chair. This is what we call the antalgic position for the disc, where you don't have any kind of pressure on it. One of the things I tell patients, usually the active ones, is that there's a couple activities we don't want you to be doing. One of those is deadlifts. Deadlifts are terrible exercise. It's probably very good for another video somewhere along the way, but it's also my website. There's just way too much compression on the disc. Sit-ups, likewise. Doing a sit-up with a lumbar disc or even a cervical disc injury, it's just a horrible idea. If you're that driven for ab muscles, let's find a different way to do it. And we also don't like you to do heavy jumping where you're doing aerobic activity where you're bouncing around a lot. I like to think about the disc as being a bank account. And so the things that you do that are helpful, like traction, extension, home exercises, those are great. They put a balance into your account. Now, if you do flexion and rotation, those are small withdrawals. Even the slightest bend forward, brushing your teeth, is a withdrawal from that account. And you can go broke doing with ATM fees, right? And so the goal for us is to have you make the smallest withdrawals possible and the largest deposits that you can. So doing these exercises, the cat and cow exercise, getting adjusted by a chiropractor, these are huge activities to maintain your discs. If you don't do them, you could get by. But then the next withdrawal you make can get you below that pain level line, an overdraft notice, if you will, and it will send you that message, and you will definitely know that there is a disc injury involved. Questions my patients have about this is, how long am I going to be treating here, Dr. Carr? And the answer is most of our patients get better within the first 2 weeks. They notice changes right away. And the ones that do the home exercises, the ones that incorporate a little bit more of the voodoo exercises that I give to patients, they get better much faster. Because this is a structural injury, if you maintain it, if you brush your teeth, they won't get decayed. If you maintain your disc, it won't fall apart either. So I know that I've taken a little bit of your time. I know it's hard to watch a long video like this on the internet, especially with me, but I do appreciate the time that you spent watching it. And I think if you can incorporate just the idea of how the disc works, understanding that it's a biomechanical injury that has a structural fix, you're well on your way to getting fixed. Now, hopefully I have timed out this video, and I'll be walking through the door into the office shortly, and I can answer some more of your questions. If you do have questions, don't hesitate to check our website. I have a 5-page, 6-page article on there about the disc, www.dynamicclinic.com, and you can go ahead and read all about this. If you'd like to make an appointment and you're not sure if this is something you've got or not, go on the side of reason and make that appointment today. You can call our office at 206-343-3325. I'll go ahead and sit down and take the necessary time to diagnose you with this or whatever else is causing your problems, and we can get started on getting you fixed. I'm looking forward to meeting you, or looking forward to working on you if you're already a patient, and let's get started, okay? So